Hi, good evening, everyone. I'm Dr. Philip McMillan, and today I feel a sense of almost sickness, nausea, at what is happening across the world because the trust in our health system, the trust in physicians and doctors is just being completely decimated because of a failure to grasp the pandemic. For those who don't quite understand or who have heard of, say, Pierre Corey or Paul Marek, FLCCC, the recent decision by the American Boards of Internal Medicine was to revoke their licenses. I, I, I don't know what to say. I genuinely don't know what to say. And I think that because I read the comments that I see in the YouTube and I interact with people on social media, I see how damaged trust has become from the COVID pandemic. And it is very, very scary. It's very worrying because many people still need the system. It's not as if suddenly if you get sick, you can just go somewhere else. The system is there to protect you and it's there to help you. But for many people, they no longer trust the system. They no longer trust their doctors. They no longer trust that the system is looking out for their best interest, which is very, very concerning. And I think that as I reflected on all those things and how I feel now about what is happening, even I'm going to talk about it in a little bit more detail with Dr. Corey. I had started the thought of putting together this health and wellness network, answering your pressing issues. I believe for those who are connected with me, I am a voice that is balanced. I believe that I genuinely look at the research. I'm not afraid of it, and I certainly challenge any narratives. But it will become more and more difficult to do. So please, there will be a link in the description. Click on it, go to our landing page, and you will be able to join our newsletter and our network. This is what I think needs to be built at the moment, a way to help people to navigate the system. And this is what really I am looking at trying to do. In a sense, my hope is that I can try and rebuild some of that trust by just through interacting and helping people to take the necessary steps in terms of utilizing the system properly. But there is a problem around COVID. And I think that this is what has hit me so hard with regards to what has happened to Dr. Corey and Dr. Marek. And it goes back to the fact that even in my research, and so my research started in early 2020, and I was one of the first people, if not the first, to say in April 2020 this appears to be a viral mediated autoimmune disease. And I was very specific at the time. I said that I think that at the center of this is free ACE2. That's the entry receptor for the virus. And at the time, I was ridiculed by a lot of people who said, don't be ridiculous. But then steroids started to work, immunosuppressants were working. And I'm saying everything here is fitting with an autoimmune disease. Even when the research has been done and the papers are out in 2024 proving exactly what I said, autoantibodies to ACE2. If you put that in front of the majority of the people in the scientific and the health sector, they will have no idea as to what you're talking about. They will think this is misinformation. And it's just because you are so far ahead of what it is they're thinking, they don't grasp what you're doing. And so this is the same thing here now. I'm continuing to go ahead of the research because this is why I'm talking about storm. This is what I predict is going to be our nightmare over the next few months to a year. Spike triggered autoimmune responses with continuous reinfection. It doesn't make any sense to somebody who doesn't understand the science But again, there is no pleasure with being out front because it looks strange. It looks like misinformation. So let's just come back to Dr. Pierre Corey. And I just want to take you through something here. And I think what I've felt even most disappointed about with regards to this is I'll show you the news headline here. This was, there are a number of them, but this was one of the few ones that I could share. Tech Sharp. And this is talking about the fact that the American Board of Internal Medicine revokes Pierre Corey and Paul Mark certifications. And this is a celebration. This is not a goodness. This is sad. In August 4th, 2023, it was announced that both of them were having their board certification removed. And the feeling here, as somebody said here on Twitter X, they said that this has finally occurred. And finally, the two disinformation doctors have had their board certifications revoked. Let me tell you something. Any doctor who celebrates the loss of certification of someone in the health sector is somebody you should be concerned about. Seriously. I'll tell you why. And you need to follow this to understand what we're up against. So I then got Dr. Corey's certifications here. And this is his publication from FLCCC because he realizes he has to tell you what it is that he has done. And it's talking about his contributions here. Former Chief of Critical Care Service, Medical Director for Trauma and Life Support Center, University of Wisconsin. Considered one of the world pioneers in the use of ultrasound by physicians in the diagnosis and treatment of critical care patients. Helped develop and run the first national course on critical care ultrasonography. He created a handbook. And just so that you understand, this goes all the way back from 1994 when he graduated mathematics and so on. He got his residency in 2005. He was licensed in 2015. He went on, these are all his appointments since 1995, all the way to 2020. Finished here as Associate Professor of Medicine, University of Wisconsin. Continuing with critical care, memberships, honors and award. Look at these honors and awards all the way back from 1999 all the way down to 2018. Listen, this is an exceptional clinician. And there is no celebration about losing access to that kind of expertise. Now, what really was it about? He was promoting and speaking about the unmentionable. I don't even know if I can mention it. All I can say is that it rhymes with pectin. You should know what I'm talking about here. And it was taken offense that they continued to raise awareness about this, even though all of the research suggested that it didn't work. This is what you're told. Now, you have to remember, I'm coming from an objective position here because I heard about it and I myself, I didn't know, well, I don't know how that can work. It didn't make sense at the time. But I have a simple rule in science. If something works, my question is not it can't work. My question is, well, how does it work? What's the mechanism? Because if I can understand the mechanism, then I can find another solution just in case that solution is not available somewhere else. So that is what I waited on. And I listened to it at first, but part of the reason why I didn't discount it was because Dr. Corey and Dr. Marek with FLCCC were probably one of the first to be significantly pushing the use of high dose steroids in severe COVID. At that time, this was in 2020, this was even before the recovery trials showed the benefit of dexamethasone. So they were ahead of the recovery trial that everybody celebrates. They recognize steroids as critical. And that made perfect sense to me when I was looking at autoimmunity. So when I saw this, actually at that time, in conjunction with Professor Newton, we wrote a letter to the Prime Minister to say, listen, guys, you need to look at what these guys are talking about, because this is absolutely critical. Of course, it was ignored. Subsequently, Oxford identified the benefit of dexamethasone, which then changed the management of COVID across the world. They still didn't use the high dose, which is a whole different conversation, but they recognized the benefit of using steroids. And so this is the kind of mind that you're dealing with regards to Dr. Corey. They were ahead of everybody else. And so what they were saying may have looked strange. So when it comes now to them mentioning the unmentionable drug that rhymes with pectin, I knew not to discount it because I trusted that they really were doing some serious research, and critically, they were intent on saving as many lives as possible. That was their intention at the start. FLCCC then evolved into a company, and it then provides services. It makes profits. It's worth it. It's beneficial if it helps people, and people were willing to bank on them. And many people still claim that they got tremendous benefit from what they did. But with regards to the unmentionable drug, I wanted to show you what they have used primarily as the main reason that this was misinformation. And this was a big study that came out in March 2024. And this is probably one of the reasons why they had to wait for a while before they could push this forward. And this study in March 2024 was a systematic review and meta-analysis. So they looked at multiple studies across the world. This was really studied, okay? And as I said, my rule of thumb is that only happens when you're seeing benefit in some and not seeing benefit in others. So if you had a situation where there was absolutely no benefit in every single study, it would not get any attention. But clearly there were some studies that were showing benefit, some that were showing not. My rule is that if you are seeing any benefit at all, that needs to be explored, because how is that possible? That was my perspective with regards to looking at it. So I'm just going to highlight something with regards to this paper, this very important paper that is mentioned all across the world. And they highlighted that the use of the drug is still controversial, okay? Yet it has been widely used across the world. And so they wanted to do a systematic review of everything. And essentially, just to summarize it, the link is in the description if you want it. If you look at this, primary outcomes were all-cause mortality, mechanical ventilation, and PCR negative conversion and adverse events. And so that's what they were looking at, those primary things. And what they found is that no significant difference in all-cause mortality or PCR negative conversion. Now, that's the point that everybody stops at, and they say, clearly it doesn't work. This is ridiculous. How could a horse dewormer help with something like that? And it goes on and on and on. I'm a little bit more circumspect in my observation, meaning that I do know that this was used at a countrywide level in Honduras with tremendous effects. I've seen what happened in terms of Uttar Pradesh. It was remarkable, the impacts that some of the things that they did had. And so I recognize that you don't just discount something because it doesn't quite fit in the box. Sometimes it's about a population. Maybe poorer countries benefit from this and more wealthy countries don't. That could be a possibility. But the point is, I'll take you back to this study here and I'll show you what the kind of thing that catches my attention. So here you have, still in the summary and the abstract, there were significant differences in mechanical ventilation requirement and adverse events between the two groups. Now, you have to follow this mechanical ventilation, just so that you understand. Mechanical ventilation is when somebody ends up on intensive care and they have a tube stuck down their throat and they're on a ventilator. That's mechanical ventilation. Okay, that's what we were trying to block, the ability or the reason people ended up on intensive care and died. That was the target for everything we did in terms of COVID. So let me take you back to the paper. This is then what it says. Ivermectin could reduce the risk of mechanical ventilation requirement and adverse events in patients with COVID-19 without increasing other risks. And it went on, it says, in the absence of a better alternative, clinicians should use it with caution. I think this is where the problem is. In the absence of a better alternative. You see, what has happened across the world is that the better alternative, based on the narrative put forward, was for everybody to stop the pandemic with vaccines. We have a problem because it can't stop infection. It may reduce it temporarily, but it can't stop it. So what happens when you continue to have virus circulating and you continue to have people getting sick, like where we are now? If all your eggs are in one basket, what are the options? So the problem at the time, and you have to think about it, was not that it didn't have an impact. This is really remarkable. They pointed out that it reduced the risk of mechanical ventilation. How is that possible? How is that possible? That should have been the question. How in the world could it actually reduce the risk of mechanical ventilation? That was our target, not whether or not somebody had a positive PCR or whether somebody felt a bit sick or they had a mild infection. It was to prevent people from dying by preventing them getting on intensive care. How in the world did it do that? That was my question. When I saw those things, I said, hold on, this is relevant. And so when I came across the answer in my mind was here, and if you want to watch this video, I'm not going to go through it, breakthrough understanding on rhymes with pectin, because I couldn't say the word then. I have to be careful about how I say the word now. And this here was essentially a summary of some important research about PAC1. So it's a protein that helps the virus to make these tree-like structures that allows it to spread more quickly. And it seems that it has an impact on this PAC1 protein. And listen, when I saw that, that to me was mind blowing. If you want to watch it, look at the Substack, the link, and watch the whole video, and I'll explain it in more detail there. But the reason that that was important to me was not about the drug. Because once I knew the target, PAC1, all I had to then do was search out what else impacts on PAC1. And then you have other drugs. And I was able to find 10 other things that could work in a similar way as that one. You have to join my Substack to see this stuff. But what I'm saying to you is that you never ignore anything in science. If you really are looking for answers, you have to look at everything. If somebody tells me that everybody suddenly, I'm trying to think, drank green tea and they never got sick, would I ignore that? No. I would say, well, how the heck does that work? Is it true? And if it works, what's the mechanism? Because if you understand the mechanism, you can then apply it, because it's never just about one drug. Because if somebody was allergic to the drug, what other options do you have? So that's the way how science should work. But that's also the reason why I am very worried. Because If we are doing this to people who are ahead of the curve, and if we are not recognizing when they have done something remarkable, as I said, you can argue all you want about rhymes with pectin, but you have to go back to the fact that they were telling people to use steroids first. That suggests that they were on the button. They knew what they were doing. Whatever they were looking at was making a difference. How can you seriously celebrate the loss of medicine to somebody like this? And again, I just show you again, these are the awards from 1999 all the way to 2018. You know, this is a remarkable physician. Why would anybody want or be happy that he is no longer able to practice in the context of a hospital care? That's the kind of thing that we have at the moment that has demolished my trust in the system, because I realize that people have become so fixed to ideologies and narratives that they are not able to see the science anymore. And sadly, it seems they are not looking. And so when I talk about this spike triggered autoimmune response mechanism, this is what I'm predicting is happening next, people will say this is misinformation. But they don't know what I've been studying, and they don't know what I've been looking at. They don't see the science behind it. They don't understand even some of the primary pathophysiologies with autoimmunity. How then, if they didn't understand that at the beginning, are they even going to slightly grasp where we are now with ongoing circulation of the virus? Difficult times ahead, but I'd like to encourage you, please, if you want to come with this journey, if you have lost faith and we need to find ways together, I will do my best. I can't guarantee everything I say will be right, but I will certainly be trying to find answers for your pressing health issues. And critically, I will be trying to tell you how to advocate within the context of the healthcare sector. How do you approach it when you get sick or when your loved one gets sick? What do you do? Where do you go? How do you ask the questions? How do you get the help that you need? Because it is very difficult for many people. And it's very sad for me to see that 30% fall in trust in doctors, because the doctors genuinely are trying to help their patients. But something about the COVID pandemic, industry has so damaged the ability of physicians and doctors to look at science that I don't know how we're going to be able to get out of this. Difficult times ahead. But as I said, join me in this journey. Let's see if we can make some progress together. And let's see if we can rebuild that trust. Because a lot of people are still working and trying to find answers. Have a great evening.